So imagine you've just won the lottery and you can buy dental instruments. I mean, this is a preview. Or you could have signed up for a dental lab at the Veterinary Dental Forum, and you might get to use some of these instruments. I just want to go over some basics, and we're going to start with some of our surgical instruments. I like the cylindrical scalpel blade handle because once you get that blade in there, you can rotate as you need it. It's quite nice. We've got some very good scissors here, the Lagrange and the Iris tip. I like smaller scissors, especially the Lagrange for soft tissue. You need some good cutting edges there. And I also like these smaller Olsen-Hegar needle holders. If I have a cutting edge on these though, I might cut the suture, so I'll do without the cutting edge. And whenever possible, use atraumatic thumb forceps. Very, very critical. We also have a good set of small breed extraction forceps that fit nicely in your hand, not to be used with a lot of force. And oh my goodness, people who have not used some tongue depressors to hold back those floppy lips, they are worth their weight in gold. As we look at our dental instruments, we're going to talk about periosteal elevators for raising the periodontal flaps, the gingival flaps. And for most of them, I prefer a flat surface. Some people like the more rounded surfaces. But we're going to be basically raising the gingiva off the tooth and off the bone with my finger right there on the instrument. Thin, fairly delicate. Be careful with these. Before we use our standard dental elevators, we're going to be using Luxators. And this is not something a lot of vets are used to using. A Luxator has a much finer tip to it, very thin, and it is used to place in the periodontal ligament space in between tooth and bone, but not rotated. I especially like these larger ones for the flat surfaces of canines, and I will get it in that periosteal elevator space, periodontal ligament space, and wiggle it back and forth like that. Our typical winged elevators are pretty well known. You're going to have the winged sizes, the sharp tip, but these are a little sturdier than those Luxators. So when I get that introduced into that space that my Luxator helped open up, now I can rotate that tooth in the periodontal ligament fatigue and rotating in that alveolus. You can be a little bit more forceful with these, but don't overdo it. These can still break, so use finesse, not force. Kind of halfway in between those two is an instrument called the WingLux that still has the wings, but still has a sharp tip of the Luxator. And I like these, especially again for the larger instruments. Make sure you get the right size for the right tooth. And I can work this around the rounded edges of the tooth, but not a lot of actual rotation. This can also be used with the different sizes, 1 through 6. Here's a number 2 that I might use on a small premolar or cap teeth. The size of the wings need to fit the size of the tooth for the most efficient elevation and luxation. So, enjoy, use them well, use them carefully. Remember, finesse, not force. Finesse, not force.